Good morning, everybody. Thank you so much for joining us first thing Monday morning, starting a new week. My name is Melissa Minsick. I'm a senior policy specialist with the Children and Families Program at NCSL, and it's really nice to see all you this morning. Welcome to the Louisiana Early Childhood Policy Symposium for legislators and legislative staff. I'll let Libbie say hello also.
Thanks so much, Melissa. Good morning, I'm Libbie Sonnier. I'm the Executive Director at the Louisiana Policy Institute for Children, and we're so excited you could join us today. We also understand with joint budget happening tomorrow in our state that we're recording this seminar and this conference today to make sure that you get the necessary information you need to make sure that we're doing the right things for little people in our state. And we can't thank NCSL enough for helping us host this symposium.
Great. Okay, well, let's go ahead and dive right into our content for today. So just want to really quickly go over our agenda, what you should expect. We've gotten some introductions in already. I'm going to present two things now. One's focused on early brain development and how that looks in early childhood. And then we're going to talk a little bit about the return of investment on early childhood. Two presentations there. Then after that, you're going to see me again. I'm going to talk about NCSL and our Early Childhood Fellows program a little bit. I'll hand it back over to Libbie for some more information on the Louisiana Policy Institute for Children, and then we'll have a brief closing. So with that, let's go ahead and just dive right in. So our first presenter is Dr. Amelia Bachleda. She's the Outreach and Education Director of the Institute for Learning and Brain Sciences, also known as iLabs, at the University of Washington. iLabs is an interdisciplinary research center focused on human learning and the brain. As a trained science communicator, Bucleda works to put the latest science into the hands of those that can act on it and develop resources to deliver trainings nationwide. She has a doctoral degree in neurobiology and specializes in neural development. Dr. Art Rolnik. So he's kind of got a long introduction, so bear with me. He's an adjunct professor of economics at the University of Minnesota. He serves on several nonprofit boards related to early childhood, including the Northside Achievement Zone, Way to Grow, Think Small, and the New York City Early Childhood Advisory Board. He previously served as the Federal Reserve Bank of Minneapolis as a senior vice president and director of research as an associate economist with the Federal Open Market Committee. That's the monetary policy-making body for the Federal Reserve System. Rolnik is a past president of the Minnesota Economic Association and has been a visiting professor of economics at Boston College, the University of Chicago, and Lingnan College in China. He's earned numerous awards for his work on early childhood development, including awards from the George Lucas Educational Foundation and the Minnesota Department of Health. Dr. Rolnik has a bachelor's degree in mathematics and master's and doctoral degrees in economics. So again, before I start his video, please feel free to pop any of your questions in the chat. You can ask those to us that we can pass along to Dr. Rolnik, and we're also going to share his contact information later so that you can just reach out to him directly if you prefer. Both of our presenters are very open to a dialogue with you and want to make sure all your questions are answered, so please feel free to contact them. All right, here we go.
I tell people I used to worry about banks. Now I worry about babies. And the first thing I want to do is give you that backstory, how I got started on this, because I did start as a skeptic. After I give you that backstory, basically got me into the research, and I'll walk you through some of that research to try to convince you, and I think the case is overwhelming, that we're way under investing in high quality early childhood education and development for our youngest children. In fact, we argued it's probably the best public investment we could make today. But I'm not going to leave you there. I'm going to then answer the question, how do you take the research to reality? How do you turn this research that seems to be so overwhelming that we're underinvesting? How do you actually invest? And I'll talk about a pilot that was funded by the business community in Minnesota to make the case that we can take it to reality. We can get the high return. We can make a huge difference. All right. So how did I get started in this? I have to go back to 2003. There was a group of us that would meet in Minnesota for lunch. These would be some politicians, some educators, some business people, maybe about 30 of us, and we invite a person with a passion for an issue. And this particular lunch, it was an organization called Ready for K that was established by a former governor of Minnesota and a former mayor of Minneapolis. And they were promoting early childhood education. I listened and I wasn't real happy with their argument. They were basically making a moral argument that it was a right thing to do. And I was saying, you know, guys, there's lots of right things to do. The moral argument can be made for investing more in K through 12, for investing more in higher education, for investing more in reducing crime, climate change, et cetera. Policymakers have limited resources. You got to prioritize. And I suggested that maybe there was an economic case you can make. And you've asked me today to make that economic case. Okay, so that's what I started to do. I was a bit skeptical, but I knew there was some research out there, some longitudinal studies that I could go to and at least try to make that case. I explained to Ready for K, Ready for Kindergarten, the organization, that my expertise was pre-Civil War banking, that I really didn't know a lot about early childhood education, but former governor, former mayor, it's hard to say no to these fellas. So I got involved in the research. Okay. So what did we find? What did we do when we looked at the research? I went back to my office, a young fellow who was a colleague of mine who was in the education area. He was doing a lot of education with high school students. I figured he knew something about education. His name was Rob Grunwald. I said, Rob, I've committed us to looking at this research. I said, but don't worry. I'm pretty sure there's some studies out there, and we'll look to see if there's an economic case. And what we found, and it's sort of my bottom line here, is what we found is it was an inflation adjust, 18% inflation return to investing in early childhood education, starting in these early years for our most vulnerable children. So how did we come up with that? That's my bottom line. How did we come up with that? Well, we looked at a number of longitudinal studies. The most famous is known as Perry Preschool. This started in Ypsilanti, Michigan in the early 60s. Somebody had this idea, maybe we're starting too late. Maybe kindergarten is too late with these children. Maybe we have to begin earlier and get them some high quality early childhood development education. Maybe that will make a difference. So what they did is they got funding to create a high quality program, and they had 123 at-risk families. They randomly divide them into two groups. So one group is a control group that gets no resources, no program, and the other is the program group. So the methodology doesn't get much better than this, that you can really talk about causality because we have a control group. And so Perry Preschool had great curriculum, small classroom size, master level teachers, and a critical component was home visiting, working with mentoring the parents as well as the child. And Rob and I had 30, eventually 40 years worth of data to examine to see how well they did. Now this program had been studied before, so other people have already been looking at it. And what we found is the children that were in the program compared to the children that weren't, they were much less likely to need special ed, much less likely to be retained in the grade, much more likely to be literate by the 6th grade, graduate high school, start a family, get a job, pay taxes, stay off welfare, and the crime rate, again, relative to the control group, goes down 50%. Well, those look like huge benefits. So we asked, as economists would ask, and many business people would ask, what was the return on that investment? And fortunately, we had the data. We knew the following data. We had the cost of the program. Today, it was about $10,000 per year. It's a 2-year program. So we had the cost. And the benefits I've mentioned, and economists can put dollar values on benefits, like what's the savings if a child doesn't need special ed, if a child's not retained in a grade, graduates high school, gets a good job, pay taxes, all that we can put dollar values, and we can put dollar values on reducing crime. As you know, it's very expensive. The criminal justice system per person is very expensive. So we had the benefits and the cost, and there's a formula in which you can back out with that data what is the implied annual return on that investment. I told Rob that here's the formula, you program it, let's see what we get. If we can beat 5.8% annually, 5.8%, we can go back to the governor and the mayor and ready for kindergarten people and say, yeah, there's an economic case. Now, why do I pick 5.8? Well, 5.8 is the average annual return on the stock market post-World War II. So if you're going to take money out of the economy, I'm going to argue at least beat 5.8%. Then I can tell public officials we can do better than the market. So that's what I was aiming for. And as I told you at the beginning, what we found was an 18% inflation adjusted return. So I said to Rob, that's too high. It's so high, no one's going to believe it. Please go back and redo the numbers. I have a hunch we made a mistake. Well, he repeated it 3 times, keeps getting 18%. So I said, fine, Rob. I took all that data. I sent it to the University of Chicago, a man by the name of James Heckman. He's a Nobel laureate. Jim was looking at these studies the same time we were. I said, Jim, we're getting this 18% return number. I don't trust it. Would you please double check it for us and see if it's right? It took a while. Took a couple months. He had some graduate students working on this. Within 2 months later, he sends me a very cryptic note, 18%, you're right. So now I'm pretty confident I can make the case. We're way under investing in high quality early education for our most vulnerable children. While I was speaking on that, somebody like Amelia got a hold of me. Somebody in the neuroscience got a hold of me and said, Art, I know you're looking at Perry Preschool. Those were 3- and 4-year-olds. And I know you care about the most vulnerable kids. In many cases, that's going to be too late to start. And I didn't understand what he meant. This is Jack Shunkov. He's at Harvard now. He runs a Institute on Child Development there and Brain Development, and co-author of a book From Neurons to Neighborhoods. Amelia just kind of made the case very well. That brain is developed at the beginning. And I think of early childhood actually as prenatal to 5, because as we know, that brain is, as Amelia said, 25% of the brain's already developed by age 1. And so we really need to create the right environment at the very beginning. And another piece of research that I think is very poignant that I use is the work that was done with Romanian orphans. If you recall, the Romanian orphans had very little interaction with adults, only at feeding time. And so they call this extreme neglect, a part of toxic stress, if you will. Very little interaction. They found age 3, that physical brain, as you saw how it's supposed to grow, was a third smaller than what it should have been by age 3. The physical brain was a third smaller. So all that brain development research, and we've learned more and more over the years, critical in the first few years. So both the brain developed research and these longitudinal studies like Perry Preschool, and let me mention there's 3 or 4 of these longitudinal studies, they all bring you to the same point: start early. You can't wait to kindergarten. If a child's in a stressful environment, if a child's born into poverty, if a child is in a homeless shelter, if a child has incarcerated parents, our vulnerable kids are going to very likely start school well behind the rest of the kids. And the research shows that when they start behind, on average, they don't finish. And think about our economy today. If you don't finish high school, what do you think your chances of succeeding in our economy are? So that basically is the economic argument. And it's powerful, or the overall argument is powerful, because there's 2 independent lines of research. Some of the best research I've seen done on economics and clearly on brain development give you the same answer. We're way under investing, and it's not just a good private investment. Surely the child benefits quite a bit, but there's a huge public return. And I'll get into that in a later part of this talk. So that's the 18% inflation adjusted return. Later on, I'm going to say I think it's a conservative estimate. So I was very fortunate when I made this argument. There was a man by the name of Warren Staley. He was CEO of Cargill Company, one of the probably the wealthiest, the most successful private company in the world. And he was at that time chair of Twin Cities United Way, and his foundation was working with at-risk kids, but they were working with teenagers, and he wasn't having much success. He said, okay, Rolnik, that research looks good on paper. Let's see if it'll work in reality. So this part of my talk is, can we take research to reality? And I was very fortunate because Warren Staley, a very influential man in Minneapolis, St. Paul, in Minnesota, he created a nonprofit called the Minnesota Early Learning Foundation, MELF. And he invited his friends on the board. His friends included the CEO of Target and Best Buy and Ecolab and General Mills, Blue Cross Blue Shield, Best Buy, a man by the name of Charlie Weaver, who was Governor Tim Pawlenty's chief of staff, was on this board. The president of the University of Minnesota was on this board. And when Warren Staley said, all right, let's go raise $20 million, which he was able to do with these kind of friends, to do a pilot to see if indeed we can bring this to reality. And we did a very simple thing, because when the business community asked, how do you bring this to reality? We had a very straightforward way of doing this. And it sort of comes out of the brain development research, but more generally, it's sort of common sense. A critical component, a critical ingredient, if you will, for that child to develop are the parents, the mom in particular. And so our approach is very parent focused, empowering the parent. And how do we do that? We empower the parent with a mentor, starting prenatal. It could be a home visiting nurse, eventually a educating mentor, but a mentor that stays with the family. And then when the child turns 3, we give the parent an early learning scholarship to use at the program of their choice. They're empowered. It just has to be a quality program. So that was our proposal to bring it to reality. Now, because the scholarship has to be used at a quality program, we need a quality rating system. So what MELF, the Minnesota Early Learning Foundation, it financed a pilot, and it financed the creation of what we call Parent Aware. It's a 4-star rated program that we started it with essentially no providers, but eventually we're up to about 2,000 providers now that are rated. And you have to be a 3 or 4-star rated program to get our scholarship kids. So that was the pilot. We circled a neighborhood in St. Paul, Minnesota, very diverse and very low income neighborhood, with the idea that we were going to provide scholarships to low income families in that neighborhood and see if it worked. We're going to track the children, see if indeed they start ready. Historically in Minnesota, something like 70% of the kids start school ready or close to being ready. Poverty kids, it's 30%. In some neighborhoods, it's only 18%. So our outcome, if we're successful, is that they go through our quality programs and they start school ready. And that's how we would judge whether we succeeded. So we ended up giving out about 400 of these scholarships and ran out of money. My critics said this isn't going to work because you don't have 4-star rated programs in the community. Well, indeed, what happened was once the word got out that we had 400 families with scholarships paying $10,000 a year, Montessori expanded their program, Faith-Based expanded their program, St. Paul Schools expanded their program, New Horizon, which was a for-profit, actually opened up a quality early ed program in the community, which they had never had before. I'm going to argue that's real economic development. And sure enough, where my critics said there wouldn't be a supply, we had the demand side, parents were empowered with scholarships, and the market worked, if you will. Supply increased. Within 6 months, every one of our parents were able to find a 3 or 4-star rated program. It didn't take long for the market to respond. We didn't have to worry about the market. It happened organically. And critics said, well, these parents many are so dysfunctional, they wouldn't use the scholarship. Every parent used the scholarship. And when we did focus groups with our parents, their concern was that They thought the mentors worked really well. The scholarships, they were thrilled that their child got a scholarship. In fact, when we asked one of our parents, why do you think your child got a scholarship? She said, because she's so smart. And their big concern was kindergarten, first grade, third grade, was that going to be 4-star? So now I've got engaged parents, many of them hadn't graduated high school, getting involved in their parents, in child's education. The other side benefit that we hadn't counted on, which is critical today, is many of our parents went back to school and back to work because their children were now in a high quality program. They were doing really well. Their stress was reduced. They were able to go back to work. Their income went up. And all this related to reducing stress in their family, giving them a future, if you will, not just for themselves, but for their child. So we were so successful with that, and we were able to apply for a Race to the Top grant from the federal government. And in 2010, 2011, we've got $45 million to replicate it around the state, which we did. And it didn't matter whether we were on a white earth, on a reservation, Indian reservation, whether we were in rural Minnesota, whether we were in the suburbs or in the cities, families, children, all the same. We got similar results. Our kids were starting school ready, and we had data on the first and second grade and found that our kids were performing at national norms. So, which was unheard of for poverty kids on average. So with that success, we were able in 2014, 2015, we had both sides of the aisle sit down. We had the governor and the majority leader in the House who was a Republican, the governor was a Democrat. We sat down and say, okay, we now have the evidence it's working. It's been privately funded initially. We have the business community behind it because they know this is their future workforce. They need a high quality workforce. They need these kids succeeding. Now we need the government to help us bring it to scale. And we were very fortunate in a year that was a tough budget year. We got $70 million a year. As we speak now, we've had $70 million a year for half a dozen years now, close to half a dozen years. We're serving about 20% of our poverty children, and we're getting these incredible results. And like I said, even in COVID-19, where it was very difficult, we were doing a lot of quality early ed with our kids and our parents online, and are still getting very strong results. So that's what we call this the Minnesota model for early learning. I want to stress it is not simply about taking a child and putting them into a center-based program. This is empowering the parents, getting the parents engaged. It's very consistent with the brain development research. Those interactions are critical, especially at the earliest years. And we are now in the process of working with the federal money that's coming in for early childhood as how best to spend it. We have no doubt the best way to spend this money makes it very accountable, because we can show you results child by child, family by family, to use most of this money. Some of it will be used to help providers get back into the business, but most of this money we want to put into early learning scholarships. We got another 35,000 kids that we aren't serving. And I point out that every dollar in scholarship goes to a quality provider. So it provides incentive to increase the infrastructure, if you will, for this industry, but it'll be quality. It's always about quality. We don't get these results without parents and without quality. So I'll leave you with that, just kind of with the point that I'll go back to what we started in 2003, and nobody has questioned this result. That is the best, if done right, the best public investment we can make. And now is the time, not 5 years from now is the time to invest in these kids. Minnesota in particular, we have one of the best economies in the country for many years, and it's because we have a highly educated economy. But if we don't invest in these kids, we will lose that momentum. It's critical, not just for the child, not just for the family, but for our economy and the overall health and well-being of our state. So this is the time to invest if the resources are there, and they should be there. People say, oh, this is expensive. It's expensive not to do this. And you've got to look at both sides. You can't just look at the cost, you have to look at the benefits. And as I say, we're seeing these benefits. And let me conclude by, there's some recent research that tells us that this 18% is an underestimate. James Heckman was able to get funding to follow up on the preschool kids as adults. He finds that the health metrics of the adults are significantly better. Less diabetes, less heart disease. And then he was able to find out, he got data on the children of the children. And sure enough, the children of the children are doing much better than the children of the control group. They were more likely to graduate high school and go to college. So we're arguing we've got a tool that doesn't just help vulnerable kids, vulnerable families today, but we think one of the best tools to end intergenerational poverty, to close the achievement gap, to make sure all our kids have a chance to succeed in life. And even if we don't get all of them, we will get better. Even if I'm still going to get you a good return on preschool, it was maybe 50% of the kids that were succeeding. We're only going to get better as we get more data and learn more about brain development. We'll still get you a good return. And as far as I know, reading the literature on education and on health, this is one of the best tools we have, one of the best programs we have to deal with significant intergenerational problems. So again, thank you for this opportunity, and I'll be happy to answer any questions. And if you think of something later, I think my email is available. Don't hesitate to call. And in terms of resources, the Minneapolis Fed has a whole website on early childhood. You can go there. And then James Heckman at the University of Chicago has the best research on this issue. I tell people
Great. Okay, so that was our second presentation. Again, just want to reiterate that you have both of their email addresses from both presenters. Please feel free to reach out to them directly. If you feel more comfortable, you can pop your questions in the chat or just email them to myself or someone at NCSL and our early childhood team, and we'll be happy to also pass those along for you. But really want to make sure that that information is valuable, and that if you have any questions, you get them answered. So now I'm going to take just a little bit of time to talk a little bit about NCSL and our Early Childhood Fellows program in particular. So if you're not already familiar, the National Conference of State Legislatures is the country's most trusted bipartisan organization, serving all 7,838 legislators and over 27,000 legislative staff now and for the past 40 years. We track more than 1,400 policy areas ranging from everything from criminal justice reform, education, healthcare, transportation, and my area of focus, children and families. So specifically with children and families, and with a lot of programs as well, we have a newsletter. So you'll find a resource in the chat to link up to our newsletter if you'd like to receive it. That comes out monthly. And also, I just want to point out, with children and families, we cover a multitude of policy areas. We focus on child welfare, child support and family law, housing and homelessness, family economic security and mobility, and of course, early care and education, which is where I'm at and why we're here today. So at NCSL, we do a couple of things in specific for legislators and legislative staff. First thing we do is track legislation from all of those broader topics that I just mentioned. We also bring together legislators and staff from both sides of the aisle to discuss difficult problems and find reasonable solutions. We provide professional development that's specifically tailored for legislators and staff, most of which are free to you and your states. We advocate on Capitol Hill on behalf of all states. And in a typical year, we host over 100 policy-oriented meetings on some of our nation's most pressing issues. And you might recognize one, specifically the Legislative Summit. That's our big annual conference every year. So now I want to get into the Early Childhood Fellows program a little bit. So if you're familiar with it and you may have known about it from years past, you might have heard of it called previously as the Early Learning Fellows program. We recently changed the name to make it more encompassing of child development as a whole. So our first cohort was back in 2011. Last year was our 9th cohort. You can see those smiling faces there on the screen. And so this year is going to mark our 10th cohort of the program. The program is designed to support legislators and legislative staff who are experiencing or emerging leaders on early childhood and early learning issues. It's geared toward those chairing or serving on human services, education, or appropriation committees who want to expand their knowledge and learn from other legislators and experts across the country. So fellows will typically participate in a kickoff and a final meeting that are in person, with 2 virtual seminars throughout the year between those. So what are the early childhood fellows going to learn? They're going to learn a lot of things. They're basically going to have an opportunity to build their knowledge alongside legislators and staff about new research and policy. They're part of a peer learning environment, fostering the exchange of ideas and solutions related to early learning, the opportunity gap, and many other issues. They meet, connect, and learn from other legislative leaders. They can identify action steps as part of a practical early learning plan for immediate use in their states. And they also receive exclusive opportunities to speak and learn from leading research and policy experts across the field. Let's just a quick look at some of the things. And these are some photos from some of our previous meetings of actual fellows and some of the speakers. So now I want to get into a little bit of the nitty-gritty and the details and this structure and what it all looks like, right? It sounds great. Hopefully you're thinking that the early childhood program sounds like something that might interest you. But unfortunately, it's not just the kind of thing you can sign up for just as you did this webinar today. So there is quite an elaborate process that goes into it. And I just wanted to get into that a little bit to clear up any questions that you might have regarding how to become an early childhood fellow. So this is reflecting this year's timelines, the 2022 timelines as well, because we kind of have already started and we're going to start planning this meeting out. So we have a lot of these dates set. So for step 1, NCSL sends out Early Childhood Fellows Program description and nomination form to the legislative leadership of each state. The leaders will nominate up to 3 legislators per chamber, so up to 6 total from their state, that they believe would benefit from and add to the Early Childhood Fellows Program. So for step 2, all nominees are sent an Early Childhood Fellows application. So that includes an explanation of the Fellows Program, includes questions that we ask the applicants to complete. And as you can see from the timeline, that's happening in May of this year for our program this year. So for step 3, NCL staff read through all of the submitted applications once we receive them, and we select fellows. And I want to make it really clear that we review and score applications based on those responses as well, because we typically receive more applications than we can accept into the program. So we try to be really selective and give everyone a fair shake. And we will choose 25 to 30 fellows, depending on the year, the budget, and what all those things look like. And our goal really is to have a diverse geographic and political group. So we look at different parts of the country, different regions of the country, as well as like different sides of the aisle, and try to get a really diverse group to have for our fellows program. For step 4, we will select our fellows, and then they receive a confirmation letter that invite them to participate into the program. They either accept or decline that invitation at that time. And then if they do accept it, they're asked to commit to attending, as I mentioned, 2 in-person meetings, and then also 2 webinar presentations. So for step 5, they complete the program, which, as I just mentioned, has those kind of like bookendings, the in-person convenings. One is a kickoff meeting that's going to happen in June, and the final meeting will be sometime in mid-September. We haven't quite set that date yet. And then we're going to have 2 required webinars in between, one in July and one in August. So that's what the program looks like roughly in terms of participation. And then finally, step 6, fellows join in a large network of fellows alumni. And so that means they get invitations to participate in content-specific webinars and might receive some additional information from NCSL staff at different points throughout the years moving forward. So we begun also, I'd like to note, an alumni series for some additional learning in 2020. In lieu of having a new cohort of fellows during 2020, we instead launched this program that is kind of like the Early Childhood Fellows Program 0.20. So it's getting all of the information that we shared, but then giving you like a deeper dive into a lot of those issues. And that looks like a couple of webinars. It could look like one really intensive sort of event. It kind of varies from year to year, but just wanted to mention that once you would become an Early Childhood Fellow alumni, you have additional opportunities to learn with us. Okay, and so as I mentioned, that alumni network is pretty extensive. So we have about 270 fellows that have completed the program to date and are now considered alumni. Those come from 48 states, Washington, D.C., and Puerto Rico. So this map was kind of not really necessary, but I thought it was a nice visual to see how much of the country and of those territories have been touched by the Early Childhood Fellows Program and how much participation we've had. It's been really successful. And so with that, also would like to share some feedback from some of our previous fellows. So this is kind of a long quote. I'm not going to spend a lot of time reading it to you, but really just want to emphasize, that their participation in the program has been valuable, and they've let us know that it's been valuable for their work and for their abilities to serve children and families in their state. So here's one statement from Representative Johnny Lambeth. He's a Republican from North Carolina. He was part of Fellows Class 5. And these can also be found on our Early Childhood Fellows website. I'll give you another minute just to kind of look over that one quickly. And then I want to hop over to one more coming from Representative Christine Barber from Massachusetts. She was part of Fellows Class 6. And again, I'll just give you a minute to kind of look over that and just know that you can find this on our Early Childhood Fellows website that you should be able to find a link to in the chat. Okay, so really exciting news also coming out. So we have this Early Childhood Fellows Program. I believe it was NCSL's first fellowship program, but we're not stopping there. So coming to you from the Children, Youth, and Families Program also this year are 2 new fellowship programs. We've got the Early Childhood Fellows, but we're also going to be adding, starting this year, the Youth and Young Adult Homelessness Fellows Program, as well as the Child Maltreatment Prevention Fellows Program. So both of those are going to follow roughly the same timeline as the Early Childhood Fellows Program that we discussed a little bit earlier. But just wanted to point those out, that those are coming, so look for information on those. And also wanted to highlight a couple of programs from the health program at NCSL. They have a few programs as well. So one is specific to maternal and child health, and then the second one on Opioid Fellows Program. So both of these are based on the Early Childhood Fellows Program that I've talked a lot about. It's kind of like rooted and modeled after our program. So they include the same thing, the same 2 face-to-face meetings for the kickoff meeting in the beginning and the final meeting, as well as the 2 webinars in between. So again, across a couple of months span, it's very similar. But these also include an opportunity for fellows to develop individual action plans for which NCSL will provide support throughout the year. So they walk away from these programs with something very tangible to take back to their states and put their learnings to use. So just want to also mention just a little bit of differences and more specific things for each of those as well. The Maternal and Child Health Fellows Program covers intersections with Title V, Medicaid, and the Children's Health Insurance Program. So their program began in 2019. 2022, this year will mark their 3rd cohort because there was no program in 2021 last year. And their applications, unfortunately, for 2022 are closed, but we just wanted to let you know that that is a resource out there for you in case you're interested in that in the future. So with the Opioid Fellows Program, that one's focused on health policies and programs addressed by state legislatures across the country, such as strengthening prescription drug monitoring programs, developing prescribing guidelines, increasing access to things, and then also supporting access to treatment and recovery services, and intersections also with human services and criminal justice issues. So that program began in 2018. This year will mark its 5th cohort, and those applications are still coming up due. So if you're interested or know anyone that you think might be interested, please, please, please tell them about the program. Applications are due on February 12th. And so with that, thank you so much for taking the time to listen to a little bit about NCSL and our fellows programs. And I'm going to hand things over to Libbie to talk about the Louisiana Policy Institute for Children.
Thanks so much, Melissa. And we can go to the next slide. So I just want to share a little bit with you all about the Louisiana Policy Institute for Children. Our mission really is about advancing policies to ensure that Louisiana's young children are both ready for success in school and in life. And we really envision a Louisiana in which all young children birth through age 4 are safe, they're healthy, and they can reach their full potential. And our work really seeks to be a source of nonpartisan, independent information on issues concerning children birth to age 4 in our state. Next slide. Currently in Louisiana, we know this, that 67% of our children birth to age 4 have both parents or their single parent in the workforce. And that 61% of infants' mothers go back to work during their first year of life. And that childcare in Louisiana costs almost as much as public college annual tuition, which statewide is around $8,700 a year for infants. So for one child in childcare. Next slide. And so one of the things that we've really tried to look at is our workforce issue of today, and that it's a productivity issue. Next slide. And in doing so, we were the first state in the country to really be able to monetize that, to really look at the gaps in reliable, affordable, quality childcare and how that's affecting the efficiency and output of Louisiana's current workforce. Our initial report was Losing Ground that we did in 2017, and we updated that report this past spring in April 2021. Next slide. And so what we found is that childcare instability at the end of the day leads to costly parental absences for businesses and really causes larger economic losses statewide. And in the update, what we found is that for Louisiana, this has resulted in about a $762 million annual loss for employers, and then a $1.3 billion annual loss for our economy. So these aren't small dollars, these are big dollars for our state. And that the loss of full-time childcare is associated with employment disruptions, including higher rates of unemployment among mothers, and that parents really need access to quality childcare so that they can go to work. Next slide. Additionally, what we've done throughout the pandemic is we have tracked what's happening for the impact of COVID-19 on our childcare providers in our state. And we recently released our 5th survey that was done between September 29th and October 19th of 2021. And what we found is that a year and a half into the pandemic, the COVID-19 closures continue to impact our providers, and that almost half of our providers had to temporarily close classrooms this past year because of potential or confirmed COVID-19 cases, and 31% had to temporarily close their entire center. Additionally, providers still face operational challenges, but the types of challenges have changed for providers, that they reported staffing challenges at even higher rates than they did before. However, the financial strains appear to be easing for providers, largely because of the COVID-19 relief dollars that have come in federally to be able to really understand what providers need. But from our most recent survey, what we know is that childcare providers in our state have lost around $287 million collectively statewide. Next slide. And that the rebounding enrollment rates and relief grants likely contribute to these providers improved financial positions. But almost half of providers served at least the same number of children in fall of 2021 as they did in January 2020 before the pandemic. But nearly half of all providers that receive Louisiana Department of Education grants use these funds to really help offset family copays or owed balances for childcare assistance. And while many providers offer increased compensation to employees right now, raises and paid time off may not be permanent. And then if we think about the Omicron variant that we're all dealing with right now, we anticipate to see more shifts of how our childcare providers have been impacted in the state of Louisiana. This was our 5th survey, thinking it would be our last, but I think we're going to have to do a 6th survey related to the impact of COVID-19 on childcare providers in Louisiana. Next slide. And so at the end of the day, our state budget is a values proposition. And what we know is that Louisiana spends less than half of 1% of the state's budget on early care and education, despite our tremendous need and the significant potential return on investment that we just heard from our speakers today. And so the time is now, with great hope that we will see something in the budget for early care and education, and not just something, but a significant investment in Louisiana's young children in our state. Next slide. And we know this is so supported through the Ready Louisiana Coalition, which is now over 115 members strong from all these many different organizations, from chambers of commerce, economic developers, small businesses, nonprofits, and childcare providers. Next slide. That really focus on increased investment of our little people in the state. And so the coalition urges you, the legislators, to significantly increase your investment for more at-risk Louisiana children to access high-quality early care and education, as recommended by the Bipartisan Early Care and Education Commission that the legislature put into effect. The time is now. We can't waste another generation, and we really want to make sure that you help us and help the rest of the state really invest in our young children in Louisiana. And next slide. So just thank y'all for being here. This is being recorded, and so we'll make sure we share it with you. Also, we want to remind you that Early Ed Month kicks off next Tuesday, February 1st, that we're very excited about, with a full lineup of a keynote speaker beginning on February 1 with Dr. June Lee, talking about, if we're talking about quality, we're talking about investing in the people that really care for our young people. And then we'll have regional events throughout the state. Many of them will be virtual because of Omicron, but some of them will be in person with you all as legislators and business leaders. We will also have a parent advocacy training so that they can learn what they need to do to be able to talk to you as legislators, because many times they're intimidated because of your position. We'll additionally have a social media day, and then we'll end the month with a business breakfast briefing that we're really excited about, where we will launch a soft launch of a business calculator for businesses to really understand what workforce loss is costing them due to early care and education breakdowns in our state. Again, we can't thank NCSL for enough for being such wonderful partners in helping us do this today. What they offer to you all as legislators is fantastic, and we're just really proud to partner with them, and glad that they're a part of our team at the Louisiana Policy Institute for Children. Thank you.
Thank you so much, Libbie. It's been great to partner with you as well. And hopefully we've answered a lot of questions and given you a lot of really great information today, and you'll be able to tap into early ed stuff next week and beginning next week in Louisiana. That's really exciting, and look forward to all that. We're ending a little bit early, so I just want to say thank you so much for joining us today. And please expect a follow-up email with some resources and also a survey that you'll find a link to in the chat. We're really hoping that because we're ending early, you'll take just 1 or maybe 2 minutes to click on that link and just give us some really quick feedback. It's a really quick, easy survey, multiple choice. We really do appreciate all of your feedback. Take it into consideration, and really try to make these meetings and these events for you meaningful. So if you have anything you'd like to share, please, please, please take a moment to jump into that survey and fill that out for us. And please also feel free to follow us both on social media. We've always got lots of really exciting things coming up, as we've shared today, and we'd love to see you for more of that. So thank you so much again for joining. Please feel free to contact our presenters. Thank you so much to Libbie and Ruth Ann and the Policy Institute for partnering with us, and have a great day.